And now look, oh, and there she is on the screen, Kerstyn Cumley from Tellmi. I've got that right. It is Tellmi, isn't it? It's not
That's right.
Tellmi or anything like that.
Yes, it's formerly Me Too for anybody who.
Okay, there we are. Formerly Me Too. Anyway, we've got the wonderful Kerstyn Cumley, who's just appeared. Kerstyn is going to be talking about mental health service delivery and learning. I'm not just reading this off the notes here. Learning will include how evidence-based digital health tools can improve young people's mental health. Well, amen to that. We need a bit more of this. I sing in a male voice choir, as some of you may or may not know. And we're just doing a new video for the choir, and it's all about supporting young people's mental health. So we're really looking forward to that coming out. Without any further ado, Kerstyn, I'll tell you what, we are 1 minute ahead of schedule, which is a good thing. As my mother was fond of saying, you can't be on time if you're not early. Take it away, Kerstyn. Thank you very much.
Well, thank you everyone for having me today. I'm really very pleased to be here, and I would like to start by introducing you to 15-year-old cosmic Kiwi hacker. He started using it, so when he started using Tellmi, he was really struggling. He was self-harming, he had an eating disorder, and he was suicidal. And I would like you to remember him because we're going to meet him again later. I've already been introduced. My name is Kerstyn Cumley. I'm co-CEO of Tellmi, and I'm going to be talking to you about how digital tools can help young people like Cosmic Kiwi Hacker. My talk is only about 10 minutes long because I really wanted to leave lots of time for questions at the end. I'm sure I don't need to tell you all, the state of youth mental health in the UK is in a really dire situation. And the problem is that the current mental health treatment model, which is built around crisis care, really can't cope. Only 31% of referrals are treated within a year, and of them, 36% of referrals are re-referrals. Worst of all, according to NHS Digital, 75% of young people who need help don't get any at all. So if we want to change these numbers, we are going to have to focus on scalable early intervention, and that requires prevention and engagement. Why is this important? Well, because according to NHS Digital, 58% of young people aged 17 to 23 who have a mental health issue never even bother asking for support. Digital solutions are very much part of digital services are very much part of the solution. Traditional one-to-one counselling services are being supplemented by online tech services. Crisis support services provide in-the-moment help via phone, text and email. And there are already plenty of peer-to-peer forums on websites and apps available for adults. And of course, there are thousands of apps which offer CBT or mindfulness type activities. And the promise of digital solutions is that they are scalable, they're easy to access, and they're cheaper to deliver. And our experience of lockdown has made digital services more acceptable than ever to health professionals. But with all of this choice, how can we pick the right solution? Research done by ORCA, the Organisation for the Review of Health and Care and Health Apps, shows that only 20% of mental health apps pass its quality assurance process. So it's really important that you do your due diligence. And there are obvious criteria to consider. What evidence is there to prove that the service is effective? How robust is the safeguarding? And what does it cost? Perhaps less obvious is what is your own experience with the service. Far too often I see people calling services rely on carefully crafted marketing dots. And the beauty of digital is that you can download it on your phone or access it via a website and have a play. And I guarantee you that you will learn more in 5 minutes of your own use of a service than you will 30 minutes or even an hour reading company literature. In fact, the best commissioners that we work with will get a team of young people to test drive the service and actually provide their own views. There are some excellent services that I just wanted to highlight that I'm familiar with, and it's by no means a complete list here, but they include Chat Health, the Calm Harm, Calm Fear series, Doc Ready, Rooted, Kooth and Weiser. And I've also mentioned Orca, who I'm thinking you're all familiar with because I think they're sponsoring the event. They have a directory of reviewed apps, and it really is a great place to start if you're looking for new services. And of course, there is Tellmi, and I am very proud that we are one of Orca's most high apps. And I would like to tell you more now about Tellmi to give you an understanding of the rigor that underpins a good digital service. Back in 2014, we spotted a significant gap in provision. One-to-one counselling, whether it's in or it's online, is expensive and it's difficult to scale. Crisis helplines do not provide continuous support, and these mental health apps like the CBT or mindfulness ones are rarely personalised or evidence-based. We wanted to create something that was effective, it was scalable, and it was affordable. Our solution is Tellmi. It is a digital peer support service. The beauty of peer support is that it is personalised and uniquely scalable, but to be safe for young people, it must be pre-moderated, by which I mean all posts and replies need to be checked before we go live. And to be effective, moderation needs to be rapid. Young people can't be left waiting for hours before their questions are checked. Tellmi launched in 2017 and has already supported over 70,000 young people aged 11 to 25. It is instantly accessible and it doesn't draw from the existing social care or NHS workforce. Tellmi, the service has three parts. An extensive engagement programme to ensure participation, the multi-award winning Tellmi app, and unique data insights that provide a completely new way of understanding youth mental health. Let's look at each of these three parts in a bit more detail. You can have the very best digital support service in the world, but if young people don't use it, then it's not going to be beneficial. We believe that engagement must be a fundamental part of the intervention. We've learned that engagement programs need to be much more than simply putting up posters or sending around an email with a link, and our programs have been developed to educate, build trust, and encourage active participation. We run them through schools or within the community. The second part of the service is the app itself. Tellmi is a multi-award-winning, pre-moderated peer support service that is proven to be effective and safe for children as young as 11 years old. It is deliberately designed to look and feel like social media, but it is much more sophisticated than that. Young people post their problems anonymously, and through guided peer support, they learn how to help themselves by helping each other. On Tellmi, every post and reply is checked by a human before it goes live, and in-house counsellors deal with high-risk posts and provide in-the-moment brief counselling. There is also an extensive support directory designed to help young people manage their own mental health and make it easy for young people to connect directly to the huge number of support options that are available to them. Both the feed and the directory can be filtered by topic, and this means that young people with, for example, autism can connect to a neurodiverse community and see relevant directory resources. One of the things that's been really pleasing for us to see is that by sharing all of these different resources, it's really starting to spread the load and take the pressure off some of the more more frequently used services like social care or CAMS. Tellmi has been designed to be fully scalable. We forecast that Tellmi can safely support 1 million young people with a ratio of 1 moderator and 1 counsellor to every 2,857 users. And this is one of the reasons why the NHS has become so interested in our solution. The third part of the service are the data insights. Since launching Tellmi, it has already generated over 1 million data points. We sort, anonymise and aggregate this data and use machine learning to reveal new insights into youth mental health. The Tellmi insights are providing the NHS, local authorities and schools with a completely new way of understanding outcomes for mental health. We also use this knowledge to loop back to the first step and improve our strategies for engaging young people. And this approach with a digital service is a really powerful cycle of continuous improvement. What's great about a digital service is the ability to collect so much data, and that makes it very easy to measure impact. A recent review of the types of young people who are using Tellmi revealed that we are reaching young people who are typically very hard to reach. For example, 35% are boys, 23% are Black or minoritized ethnic, 16% have autism, and 4% are in social care. And we feel very proud to be supporting some of the most vulnerable young people in society. But of course, the most important question that you're always going to need to ask is, does it actually work? And last year, the Evidence-Based Practice Unit, which is a collaboration between UCL's Faculty of Brain Science and the Anna Freud Centre, conducted an independent evaluation of the Tellmi app. The study of 876 young people found that using Tellmi led to a statistically significant improvements in young people's mental health. And if you would like to know more about that study, please visit our website. I think the Anna Freud team provides a really good model for how digital interventions can be measured and tested. To summarize, what I've tried to do with this case study is to highlight, first of all, that engagement is absolutely critical to successful digital intervention. I think often it can be felt that if you move to digital, you don't need to do anything in the real world, and we just don't believe that's true. We feel that engagement is often undervalued and therefore underfunded by commissioners of digital services. But I just want to re-emphasize that if a young person doesn't know about a service and they don't trust a service, then they won't use it. Our impact data shows that digital services can provide new routes of access, particularly for young people who are traditionally harder to support. And I hope you'll agree that I've illustrated that there are digital services like ours that are just as robust and evidence-backed as the more traditional real-world approaches. Before I end, I want to just return to Cosmic Kiwi Hacker. 5 months after his first post, he posted this one. I don't want to jinx it, but I think we've done it. I haven't cut in ages. I'm 2 months clean. I'm eating 2 or 3 meals a day, and after countless relapses, I'm now stable. I'm balancing college and a part-time job, and I don't feel like ending it anymore. Thank you to everyone that's helped me. Seriously, you are the reason I'm still here today. Thank you. Final slide with my contact details. Oh, don't worry about it, but I'm now very happy to have a broader discussion and answer any questions that you might have.
Well, thank you, Kerstyn. I really appreciate that. If I can start while other people are thinking of the questions they may want to ask. Look, we'll have people on the call today or watching this as a recorded catch-up who are at the epicenter of children and young people's mental health services, and they feel like they are overseeing a service in terminal decline. They know they simply don't have the capacity to meet the demand. They know that, you know, further demand is being pent up all of the time. How do they take stock? How do they evaluate the different digital solutions that may or may not be available to them? And I appreciate it. Let's not talk about Tellmi here. Let's talk about how does one of our members evaluate the myriad of different offerings that are available for children and young people? What are the evaluation key points you think that are worth looking at?
Yeah, well, as I said, I mean, the first thing would be to have a look on Orca. You know, Orca is a phenomenal directory. So, you know, I guess you need to, you need to, what are the outcomes you're trying to solve, or the problems that you're trying to solve. So, for example, if you're looking for something to support with anxiety or depression, for example, you could go to Orca and you could immediately get a list of apps and digital services that they've reviewed. So that's a great start point. The NHS, now it was under NHSX and I'm not quite sure where it's moved to, but the NHS have been putting together some playbooks, some really interesting digital playbooks. So this is where they will create case studies of digital service that have been piloted or actually used within the NHS in different regions. I think there's another round of them due to be coming out soon, but they are certainly, you know, they provide really interesting case studies of digital service that piloted within the NHS in different regions across the UK. Obviously, this happens anyway, doesn't it? You know, commissioners need to talk to each other and be finding out what across the country. I mean, a big problem for us as digital providers is a frustration is that lots of our services are designed to be delivered at scale, at national level potentially, but often have to be commissioned piecemeal, which in some ways doesn't make sense. And I'm sure that's a debate
Could
for
we
a day.
sorry to interrupt you, because there hasn't been a question about the commissioning and the funding and so on. So
Yes.
again, can we just talk very quickly about that? Because
Yeah.
you began to refer to it. So one of our members watching this, where do they start this process of exploring what funding is available at a local level?
Yeah, I'm not sure I'm the best person to ask that, because the way we are commissioned, and where I see other services, say like Couth or WISA, obviously that comes from some allocated funding from a budget that can either be prior to the whole sort of ICS introduction, that would either be from a CCG, or it could be from a local authority, from an organization, from organizations deciding they want digital services. What we are seeing though as well is that more and more NHS or local authorities are really considering and requiring the use of digital as part of their broader specification. So historically, the spec that might go out to, say, specification for mental health services or CAMS wouldn't have required a digital component. And what we're seeing is that specification is now starting to change and be updated. And so that for the person sitting in the ICS, that's a great way to start, because if you require it, people will come and deliver it. If you don't require it,
unfortunately, it's quite nebulous, isn't it? This idea of go and chat to the ICS.
It is.
Yeah. So who, where, how?
Absolutely.
What are you engaging with particular people in the ICSs, or is that not part of your pay grade?
Yeah, we do. I mean, this is, I think, this is the same for anybody trying to sell into the ICSs. We have direct links to commissioners, and commissioners will come and seek us out. We will respond to those invitations to tender. That's on a bigger level. Often quite a lot of our early work was funded through pilots, where a local authority or a CCG had a pot of money. We've done one in Somerset that's then led to a full commissioning, and that's a great way for them to test and get a better understanding of how a digital works. And you can do that relatively cheaply. Some of these pilots cost, well, definitely under 100 grand, but somewhere between 50 to 100 grand, and that provides, say, a year of getting the local area getting to understand what a digital service could offer.
All right, thank you. Let's just see if there's any further questions come in. Has anybody got a question at all who they might like to ask? Do please feel free to unmute and put your virtual hand up, and we'll put those straight to Kerstyn. It's Kerstyn or Kerstyn?
Well, it's Kerstyn. It's spelt Kerstyn.
Swedish name. I love this. I love the kind of diversity of names, and it just shows. Never assume that you know from reading it how to pronounce it. There we are. Anybody got a question at all? Anybody out there from CAMS, children and young people's mental health services, who's got an observation here or an opinion even? I mean, these are services that are under such strain at the moment. It's just heartbreaking. I wrote an editorial, probably 3 or 4 months ago now, about a personal experience of just walking down a path near where I live and finding a young person, who just self-harmed and so on, and it was heartbreaking. But the volume of response I got from members saying, "Blimey, John, you don't know the half of it," was just extraordinary.
I think one of the things that we see is that there is a nervousness from real world practitioners as to how a digital service might then impact their role. And what I can just do is reassure people that the real world services are always going to be needed. This is not really about replacing.
Yeah.
It's about supplementing, and it's about helping those real world services do a better job. So we have a lot of our users who are also being supported by CAMS or by social services, and they use us as a way having support when they can't get to their CAMS counsellor. That's a once a week engagement, or also to be able to prepare better. So we'll often get questions like, I'm meeting my counsellor next week and I haven't been opening up. How can I tell them what I really want to tell them? So there's a lot of potential synergy between real world and digital that I think often we experience that people working just in the real world space feel a bit nervous about. But you know, and I see that with some of the other services as well.
If you could point to the future at all, just finally, where do you think digital technology support for mental health services is going to go next? What's the next evolution of this stuff, do you think?
Oh, that's a big challenge. There's so much going on. I think there is going to be a modification to how counselling is delivered. So there have been some disappointing results with some of the text-based counselling services. I was just reading some of that in America. There's some really interesting work obviously around machine learning and how that can help counsellors do their jobs better by providing them with better knowledge of and information. I think we really have to tackle this engagement issue, though, just as I said, that digital services are only good if people use them, and we have to recognize that it's no good just to put it out there. For the early intervention space, you have to get young people engaged and aware of a service before they're going to use it, and that requires some real world work as well.
All right, thank you ever so much. Thank you very much indeed, Kerstyn. We really appreciate you coming along.
Thank you.